Hello, I am John Gumbs, PharmD, and on behalf of CME Outfitters, I would like to welcome and thank you for joining us for today's CMEOCast episode, The Role of the Pharmacist in Identifying Signs of Opioid Use Disorder in Our Patients. I am pleased to be moderating this discussion. I am the Associate Dean for Clinical and Administrative Affairs and Professor of Pharmacy and Medicine in the College of Pharmacy at the University of Florida in Gainesville. I'd like to welcome my colleague, Carol Matichka, who is the Assistant Dean for the Jacksonville campus of the University of Florida. Carol is Campus Director and Clinical Associate Professor at UF Jacksonville. Carol brings a wealth of experience from her work at the retail pharmacy level as well as academia. Welcome, Carol.
Thank you, John.
To frame today's episode, let's start by reviewing our learning objective. Our first objective is to review screening tools for opioid use disorder that can be implemented in the pharmacy in patients who are dispensed an opioid. We also want to look at our role as pharmacists in recommending and/or dispensing naloxone to individuals who may be at risk for opioid overdose. And finally, we will review the available treatment for opioid use disorder. So Carol, let's start by talking broadly about the role of the pharmacist in addressing the opioid crisis. Where do you see the pharmacist fitting in to the treatment team?
That's a really good question. So pharmacists can really play a lot of different roles in the opioid crisis, anywhere from direct patient care to education in the community. And I think first of all, what we need to remember is that we need to maintain good communication. Good communication with our patients is certainly key, as well as with other providers. So when pharmacists communicate well with their patients, they can really help reduce some of that stress that patients can feel in regards to stigma. That's often associated, unfortunately, with opioid use. So getting to know our patients, opening up that line of communication, and really having frank, open conversations about some of the possible risks of using opioids is extremely important. And this is also true about just communication with prescribers so that both parties really understand the various risks of the adverse effects that we can see from overusing them. So that really brings me to my next point as well about educating our patients. Once we open that line of communication, we really want to make sure that patients are fully educated on the proper risks of using opioids, as well as naloxone, as you mentioned earlier. And so this education really should not only talk about opioids and their risks, but how do we dispose of opioids, and why is it so important to dispose of those as well?
So I guess, Carol, a lot of it just boils down to trust.
Yeah, absolutely. That's a huge key portion of this as well.
So Carol, let's start by talking about screening for opioid use disorder, or OUD. What role do you see for the pharmacist in screening?
So screening is really a very important component of caring for our patients. Talked a little bit about stigma, and that can really make it a little bit challenging then to ask those really personal questions that we need to ask about the misuse of opioids. However, again, if we can really make sure that we're communicating effectively with our patients, then we can build relationships and it becomes less of an issue. Part of that just starts with making sure they understand why we're asking those questions. We want to make sure they understand that we really have their best interest in mind when we're asking those questions. And screening can be as simple as utilizing the PDMP, or Prescription Drug Monitoring Program. But it really can't just stop with the PDMP. PDMPs are great. They help reduce opioid prescribing, they decrease adverse effects, and they decrease mortality rates, but we can't just go on the information in a database alone. We really need to ask follow-up questions, not only to the patient, but to the providers as well. We need to know what the full picture is before we make any kinds of assumptions, of course. And if we do discover that there's a possibility that the patient has opioid use disorder, then knowing where to go for resources and providing those resources to the patients is extremely important. There are screening tools, as I briefly mentioned. Some may have heard of these before, but CRAFFT and Assist, these are two screening tools that are used regularly. And these really help us and just guide us in understanding whether or not the patient is at risk for having opioid use disorder. It doesn't necessarily tell us, yes, for sure they have that disorder, but at least lets us be on the lookout and provide them alternative treatments or to get them some options and assistance that they might need. And there are actually opportunities for pharmacists to be reimbursed, not only pharmacists, but other practitioners in screening our patients. So it is a very important thing to be doing.
Thank you, Carol. I think the issue around resources goes both ways, as I understand it. One is the pharmacist as a liaison, putting the patient in touch with the available resources, but also the pharmacist making sure that they have access to resources that they can use as well.
Oh, absolutely.
So, Carol, what are the red flags that typically tell you that maybe some more questions need to be asked of the patient?
So that's a very good question. And it depends on where the pharmacist works. They actually might be provided some of those red flags by the company that they work at. But there are also various resources that pharmacists can look towards for understanding what red flags maybe they should be on the lookout for. And again, remember, these red flags shouldn't be the say-all for whether or not somebody may have an issue. We really need to dig deeper. But some of those might be in the way that the patient presents the prescription. So for instance, perhaps the prescription is written for somebody else. That doesn't necessarily mean that that could be an issue, but it is something to keep in mind. Perhaps another pharmacy refused to fill that prescription. That could be a red flag. Or if it looks like it's altered, certainly that is something to be concerned about, but then also looking the other way, whereas a prescription might be completely flawless. And if it's completely flawless, then you might be wondering, is it perhaps not a real prescription and something to consider? Patients' behavior. So if they're pressuring you to fill the prescription even though you're uncomfortable with it, do they appear sedated? Are they confused? Do they seem intoxicated? Perhaps they're seeing multiple healthcare practitioners and they're getting prescriptions from all of them or going to more than one pharmacy. These are just some things to keep in mind when we're looking for various red flags. And then certainly just looking at the patient's profile and seeing, are there duplications in their medications? Are they getting too long-acting opioids, for instance, or too short-actings? This could be a concern. Then we have various cocktails that sometimes we'll look out for. So, for instance, combining an opioid with a benzodiazepine and muscle relaxant. All of these could be a potential red flag and something that you might want to delve into.
Excellent insight, Carol. Thank you. Carol, are there validated screening tools that a pharmacist can integrate pretty easily in their day-to-day practice?
So there are, and I briefly mentioned a couple of them, such as the CRAFFT and the ASSIST. I will tell you it can be challenging sometimes to be able to screen our patients, but it is a very important thing to do. Just recently, the U.S. Preventive Services Task Force issued recommendations that all adults should be screened for illicit drug use. This includes improper use of prescription medications, and really the pharmacy is a great place to be able to do that and to have conversations with patients. I will say there are always barriers to utilize these tools, and one of them might be lack of time. The other one, as I mentioned before, is sometimes that stigma and patients being unwilling to share their information with others. And then reimbursement can sometimes be another barrier, but I think it's something that can certainly be overcome. There are various apps that are available that actually have the screening tool within their app. And so if you can have something like maybe an iPad or some type of tablet that the patient fills out while they're waiting for a prescription, this is a great way then to be able to get that screening completed and to be able to have a frank conversation with your patient.
I totally agree, Carol. And I'm not a health economist, but I would be surprised that you couldn't prove value on reimbursement for these type of services over the long run, given the amount of downstream implications and prevention that it could have. You have to put a little plug in there for people to get a little bit more serious about reimbursing for those type of services. So, Carol, let's switch gears a little bit. We've seen some positive effects of expanded access and pharmacist dispensing of naloxone. The CDC recently came out with data that didn't prove, but aligned the increase of naloxone access with a decrease in overdose deaths. Can you comment on that?
Certainly. And naloxone really is a game changer in decreasing our rates of overdose. It's kind of like putting a fire extinguisher in the hands of every single person. It's just having that available for just in case. It's very important. And now that we have expansion of access to naloxone in pharmacies in many states, allowing pharmacists to actually provide naloxone without a prescription, it's really helping save lives. But I think one of the most important things to remember is you still have to have proper education for our patients. So it's this great tool, but it has to be utilized properly. And the data really shows that actual overdoses may not have necessarily decreased, but the deaths from those overdoses have, which is extremely important. But I always emphasize to patients and to caregivers is the absolute need to call 911 when you give naloxone. The most important step when giving naloxone, because truly it's at that step when you call 911 and perhaps get somebody help, particularly if they do have opioid use disorder, that you can really make a difference, because we don't want to see a repeat issue that happens. That is huge in the education process. Call 911, and I always emphasize that. We now actually in emergency departments have what are called peer addiction specialists. Oftentimes they're that first touch point for patients when they come in after an overdose, because we as healthcare providers can talk to individuals till we're blue in the face sometimes, and it doesn't necessarily make as much of an impact as somebody who's gone through it, somebody who's gotten the help they needed. That really is such a huge important step.
Excellent point. So you have the fire extinguisher, but you don't have to put the fire out by yourself, and make sure that you access emergency response people to participate in that process. We know pharmacists have excelled at both dispensing and counseling for ages, Carol, but let's talk a little bit about dispensing naloxone and counseling patients about what to do, since they are two different skill sets. What should pharmacists be prepared to tell patients about naloxone, and are there educational resources available to help them do that?
Yes, absolutely, to all of those. Unfortunately, education to pharmacists about naloxone is not as widespread as we'd like it to be. And I think we're doing a much better job now, particularly in pharmacy school with our pharmacy students, and giving them that information. But there are some pharmacists who just still don't feel real prepared in regards to educating patients about the proper use. So this is extremely important component, not only giving the naloxone, but educating the patients properly. So there's lots of resources that are actually out there. One of them is prescribetoprevent.org. There's the Harm Reduction Coalition. GetNaloxoneNow.org is also a good place to look. And even the manufacturer's website has some great information there as well. But some of the key things that I emphasize to patients as well as to caregivers is, first of all, recognize what the signs of an overdose are. It's extremely important. So is the person unresponsive? Do they have blue, pale lips or skin? Do they seem to have a slow heartbeat? How is their breathing? Is it slow, irregular, or perhaps they're not breathing at all? Some people get like this choking or gargling sound that we call it a death rattle, and that may also be a sign of overdose. And sometimes people vomit, but not often, but it's something to keep in mind. Make sure that you recognize what the sign of an overdose is, and then understand that it's not necessarily a cure. It certainly reverses the dangers of the opioid, but we really need to call that 911 as well. We have 3 different formulations that are available. There's the injectable formulation, there's an auto-injectable formulation, but it's quite expensive. So if patients don't have insurance, I don't really recommend that one because it is very expensive. We have the prepackaged nasal spray, which is very easy to give. And if you have somebody who's maybe afraid of needles, I would always recommend that they give the nasal spray for those individuals. And so then once you've educated them on looking for an overdose and figured out which product to give them, then provide them the various steps in regards to providing that Narcan. First thing I tell them to do is, if they think somebody is overdosing, is to do what's called a sternal rub. So they take their knuckles and you just kind of rub it into the sternum. And I don't know if you've ever done that before, but it's quite painful. I mean, you can almost try it on yourself and you can see how painful it is there on the sternum. And that should be enough to stir somebody. If they're not stirring, they're not moving, then you could very well have an overdose on your hand, particularly if they're utilizing opioids. And so then at that point, and you'll see it's different in the manufacturing information. It's a little bit different on where to call 911. But if somebody else is there, I always say have that individual call 911 while you're administering the Narcan. Now, if they're able to do both at the same time, then I say that is a fantastic thing to do as well, because remember, time is brain. So the quicker you can get somebody over there, especially if the Narcan doesn't work. So for instance, some people might have hypoglycemia and it looks very similar to an opioid overdose. So if your Narcan doesn't work and you haven't gotten 911 to start coming over, then you're risking all of that as well. So I always emphasize, plus I want to make sure that they're calling 911. It's such an important step. So if somebody has taken a very long-acting opioid, for instance, and somebody decides to provide Narcan but hasn't called 911, then they might slip right back into that overdose and not realize that they needed to do this. So I can't emphasize it enough. Call 911, and then at that point, administer the naloxone.
Excellent advice, Carol. Naloxone is obviously a game changer when it comes to emergency reversal, but we also have some new information and some important information when it comes to dealing with the underlying problem, and that's the opioid itself. Obviously, I'm talking about medication-assisted treatment. Let's talk a little bit about that. Can you give us a brief overview of the available options for medication-assisted treatment?
Sure. Talk about 4 options that we have available with MAT, or medication-assisted treatment. The first one being, which probably a lot of people are familiar with, is methadone. So methadone is a full mu opioid agonist, and it's actually worked well for pain as well, and we still utilize it for pain. And that is something that is available. It's been used for many, many years, but some people get a little bit nervous about using methadone because they feel like you're just switching one opioid for another opioid, or another dependence. Buprenorphine came on the scene not too long ago. It's a partial mu agonist, and it does have formulations that allow for longer visits between dosing, which is great, and some less risk for then diversion if you're worried about that with its monthly depot injection. It also actually comes in abuse deterrent formulations, so you can combine buprenorphine with naloxone, and this will help in regards to a patient who might be utilizing it to crush, to inject, etc. And then lastly, naltrexone is another option, and particularly we see this used in the jails. They'll use naltrexone. This is a great option if you don't want to use a full or partial mu agonist, then they'll use it there. One thing to keep in mind is that we do have pharmacists who are specialists who can really work with various providers and help create medication plans. And this is a growing field in recent years with pharmacists, so it's a great specialty.
Yeah, good point, Carol. I think the other thing that is growing is the research in the area of medication-assisted treatment, and I would encourage our listeners to keep their ears and eyes open, because there's a lot of work going on and a lot of research going on, particularly with buprenorphine, around alternate dosage forms, ways to make that drug a little bit more active with less side effects. So a lot of exciting things on the research front when it comes to medication-assisted treatment. The other thing, treatment typically just alone is not enough. And networking within our communities to be able to connect patients to treatment services is super important. What steps can pharmacists do to educate patients or their peers about treatment services in their community?
Yeah, and I think that's one of the hardest parts for pharmacists is, where do we refer our patients? So we have patients that we know need help. We need to know where to guide them. I mean, that's very, very important. You've got a patient who's there and they need to be seen right away. And if you don't know where to send them, you might lose them. You might lose them in the system, or they might not come back if you can't get them some help. So particularly here in North Florida, we have trouble sometimes with some of the local options that they just can't take that person. They say, we might have a bed in a week or 2 weeks, and of course that's just not enough time. So having multiple places at your fingertip is extremely important. One of the things that I recommend, and one of the things that I always do, is I have a full list of facilities that are in the area, and I like to know which ones take insurance, which ones take the government plans, so that depending on the patient who comes to you, you'll have some of those various options for you. Now, you can actually go on the SAMHSA website, and that stands for Substance Abuse and Mental Health Services. That's a great place for people to start. There's a link that's actually right on the site in which you can look up opioid treatment programs in your area. There's a directory, and you just put in your state. You can find the locations nearby, and you can provide that information. So at least having that and knowing where to go is really important. And then, although it only has the phone number and the address, you can certainly call those places and then keep your list of which places take various insurances.
Carol, that's unbelievably wealthy information. Thanks for that insight. I can't imagine that most pharmacists won't find that valuable. So let's wrap up with our SMART goals: specific, measurable, attainable, relevant, and timely.
So some of the things that I hope providers, pharmacists take away from this is really, first of all, remember not to stigmatize our patients. We're really ultimately trying to give the best patient care we can, And so we don't want to stigmatize our patients. Also, think about some of the screening possibilities that are out there. Can you screen your patients at your clinic or your pharmacy? Is that something that's an option, and how could you possibly make that work? And then education. Education is just absolutely huge, not only of the opioids, but for like Narcan, for instance, and just really having a good understanding so that you can provide that to patients is so important. And then have referrals at your fingertips. Have some options that you can provide to patients when they're there in front of you.
Carol, thank you so much. I really appreciate your time today and appreciate your relevant, insightful, and valuable information into this extremely important topic.